Hi everyone. Um, Welcome again to this small spaza shop of mine, of a channel that I'm trying to grow. Hopefully next time I will start experimenting with editing my videos. I've been saying that, but I've been struggling to get to that. Actually, what prompted me to do this video even now is a question I came across in one of the Facebook medical officer groups about corporate medicine. And there is a doctor on Instagram that the poster was referred to, who had shared some insights into corporate medicine, Dr. Mela. I will share her link or a link to her videos somewhere in the description. Right. So I thought I because she tried to cover as much as she could. And I think because corporate medicine is not really a defined type of medicine. It's just something, it's a term that we use loosely. And I like how Dr. Mela, how she described it, what corporate medicine is. Because corporate medicine, essentially, it's how we understand it, is that it's that sector of medicine concerned with the corporate sector. Essentially, you work with businesses and companies. That's what corporate sector is. So corporate medicine has more to do with that. But the difference, because corporate medicine, if we were to be technical about it, is essentially private medicine. Anything that is not within the public health space would fall under corporate medicine, because even your NGOs have now become a corporatized, if I may use or invent that term. So so even those who are doing research, in essence, they are in corporate medicine. But in reality and in practice, that is not what we are referring to when we talk about corporate medicine. We're not talking about non-public health sector medicine in its entirety, because it's very broad and composes of different subsectors. Okay, so essentially you're working with companies and businesses. That's what you're doing. What I'm gonna try and do quickly in this video is just give you a broad overview. Hopefully I'll be able to do follow-up videos on the subject. Dr. Mela tried to break down, she did this a couple of months back. It's a pity that I'm only seeing her videos now. Because she tried to break it down broadly and then give the different roles people can expect to apply for or work in, and then also answered some questions about the working hours and compensation, right? So those are things for me especially the compensation part, I wouldn't go into because it's quite complex. It's not as straightforward. Um, yeah. So the first thing that I need to highlight is that in corporate medicine, I think the broader understanding is that in working with big corporate companies, not your SMMEs and smaller organizations and businesses. I don't think when we talk corporate medicine, we have that in mind. I did say technically they are part of that, but in practice and when we talk, it's not what we are referring to. Okay. I don't think it's what people have, a picture of. I don't picture myself working at a small factory somewhere in one of the small towns in Northwest. That's not what I picture when I talk about corporate medicine. But either way, the first thing I need to highlight is that in corporate medicine, you can either be an employee, which means you are employed, you have a contract, employment contract, you have working hours, and you are subject to a performance contract and the normal labor related matters, employer-employee relations factors. So you can either be a part-time employee or a full-time employee. Okay. Then, if you are not an employee, you can still practice and cooperate as a contractor, independent contractor. What independent contractor means, and it's becoming a thing now, and not only in the medical space but across. What independent contractor means essentially is that you are not employed. I pay you for a specific deliverable. So me and you have an agreement that I'm contracting you to perform 1, 2, and 3 at a certain rate. It can be an hourly rate, it can be a daily rate, weekly, monthly, it doesn't matter. But you get paid per task that you've delivered. So the difficulty with being a contractor is you are not English fails me, and it's early hours of the morning, so yeah. So you are not. I don't know what the English word is now, but you will not receive the same rights and privileges an employee will. So if an employee is sick, they can use their sick leave days. If an employee needs to go away, they've got paid annual leave. You don't enjoy the same rights. You have to deliver. If we've agreed that per day you must work so many hours, that's what you get paid for. If you work 3 out of the 5 hours that we contracted you for, you get paid 3 hours. And now, with independent contractors, there are penalty clauses that if you underperform or underdeliver, you will actually get penalized in terms of payment. Independent contractors don't sign employment contracts. They sign what is known as an SLA, a service level agreement. So you essentially operate as a business that is contracted to perform work for this company. So this can be done in a number of ways in various sectors within the private or corporate space. Okay. As an employee in corporate space, things have changed since COVID. So yes, some companies still require people to work traditionally based in the office on a full-time basis, but some companies allow employees to work from home based on the models that were used during COVID. So there are companies that allow their employees to work from home full-time. Then there's also the hybrid model where some days you work in the office, some days you work at home. So it's different for different companies depending on the needs and the operations of the company. Okay. For instance, if you are running a corporate clinic, staff clinic, like some of these big companies can employ you or contract you, depending. Let's say they employ you to be their doctor at the corporate staff clinic. Some have staff clinics, so they'll employ you to work there. Now you know, logically thinking, I know there's telemedicine, but logically speaking, majority of the time you really need to be there physically. They do have nurses and who are skilled in emergencies and all of that, but sorry, you get employed because your skills are also needed. More especially those who get employed as occupational medical practitioners, definitely you have to be there. I know some OMPs, they in certain instances they have the occupational health practitioners, which is professional nurses with a post-grad diploma in OC health. They let them do the physical assessment and all of that, and then write the report, and then the OMP just signs off. But generally speaking, you are required to be physically present. The nature of the job requires you to be physically present. People who enjoy the privilege of working from home are people who mostly do admin work, who work with reports and policies and all of that, analyzing information, and maybe even their meetings are online, most of them. So they get that privilege to work from home. They don't deal directly with clients or patients. They deal mostly with paper. So yeah. Then, so there's hybrid, there's office-based, there's working from home. Some people or some aspects of the job might require you to be on the field traveling. So there would be aspects where you would get sent to a certain place to perform a certain task, also part of the job in corporate. Then there would sometimes be traveling involved, which is besides you being sent to perform a technical task, you may be sent to meet with stakeholders, to maybe assist a certain team in another town or city. You may be asked to attend a conference or a workshop out of town. So those kind of things come up in corporate medicine, and actually you are allowed to ask when you go for interviews, because some people have families, and traveling is not for everyone. Not everyone really not everyone looks forward to the traveling part of the job because they want to be with they need to be with their families. So you are allowed to ask how much of traveling in terms of the total percentage of your responsibilities, how much of it is traveling. Sometimes it's 10%, sometimes it's 25, sometimes it's 50, sometimes it's 90, depends. Okay, so that is the location, office-based or working wherever. Right, so the different types of jobs that you could do. Let me first make this clear that even if you are in the corporate space, you are either a GP/medical officer or you are a specialist, which is a fellow of the college, right? So whatever you might be working as, whatever title you might have, clinically, you're either a GP or a specialist. This becomes important in certain instances, by the way. It might not sound important, might sound like it's just the semantics, which are irrelevant, but it's very relevant. And one of the places where it becomes relevant is, I'll give you 2 examples where it's relevant. 3. Okay, let me give you 3 examples why I'm mentioning this. 1, the pay scale. We have this mentality as doctors in South Africa. Maybe less so now, but back then we used to look down on certain specialties, family medicine being one of them. We looked down on family physicians. We looked at family physicians as equivalents of GPs. It's just a glorified specialist, but they essentially do what a GP does, right? But in the private space, let alone that in government they get employed as consultants and all of that. Let's leave government out of it for now. But in the private sector, even when they have their own practices, a family practice or a GP practice, if you may, certain medical aids pay them higher rates than GPs. That's 1. 2, certain companies actually want family physicians. They actually are looking for family physicians, specialists. And although the job they do, the GP, a GP with experience might also be able to do it, but they will specifically state they want a family physician. And the pay, or sometimes what they will do is they will say medical officer or family physician, but when they actually make the job offer, the offer will not be the same. If they were employing an MO without a specialty, the offer they will get will not be the same as if they would have gotten a family physician. So it's important. That's number 2. Number 3, we've got cases, some of us, the jobs that we do, because I'm sort of in the corporate space, but I work for a parastal, so you'd argue that I'm still in the public space, but I'm not. I'm not employed in terms of the Department of Public Service and Department of Public Service Administration. something like DPSA though. So because public servants are either employed under DPSA, under Ministry of Police, which is SAPS, under Intelligence Ministry, or okay, and then military or local municipality. So majority of public servants fall within those thingies, those departments. So I fall under neither of those. We have a department we report to, but we are a parastal. We operate as a corporate entity, but subject to PFMA and other government regulatory framework, right? But I'm saying that even in the space I'm in, we often have to get involved in issues of litigation. And one of the things that come up sometimes is when the legal practitioners run out of technical legal arguments to make for their case. What they will start doing is they will start now playing the man instead of the ball. So they'll start attacking you and asking you what qualifies you to give this opinion that is challenging whatever they might be saying, which might be coming from their own experts that they've appointed, right? So if you are a person who is easily intimidated, you can be intimidated by such. But it becomes important, as I'm saying, because now their experts would normally be specialists. And I'm not a specialist, but I make arguments and give input on certain matters. And if I apply sound clinical principles that are based on, clinical evidence, then they've got no leg to stand on, right? So, but sometimes it does become important. That's why I had to so the different roles that would come up in corporate, I've mentioned you're either a GP or a specialist. So you could be running a corporate staff clinic. A lot of these companies, they've got the big companies, they've got a staff clinic on site. Sometimes they hire GPs there. Sometimes they hire the occupational medical practitioners. Remember, occupational medical practitioner wears two hats. One hat is to make assessments about whether a person is fit for a particular job or not, based on their health, right? They don't make that decision on their own. Sometimes they need input from the multidisciplinary team, so they might refer a person for further testing and investigations. So they have that responsibility. So they will do English, when you get employed, the clinical assessment that's done, the medicals, they call them medicals. So when you get employed, that's who you do. You get sent to the staff clinic, occupational clinic. That's who you deal with. You deal with the nurse that is working there, who would have most likely a postgraduate qualification in OC Health. Then this doctor. So the doctor might be a GP, but most likely will be an occupational medical practitioner. So you can be doing those assessments, the entry and exit medicals. So depending on what job you'll be doing, because like in the mines, for instance, especially if you're going to be working in the gold mines, remember that gold mines were implicated in exposing a lot of people lung disease, TB and other lung disease, chronic lung disease. So they need to see before you go there, before you go under the underground, that you did not have pre-existing lung conditions and then later claim. Then when you exit, this is not only the mines, it's common in the manufacturing space, even with other companies. Then when you leave, they also do the medicals, so that they can state with certainty that, look, when you left here, your lungs were fine. There's the x-ray. Or your back was okay. Here's the x-ray. Or your blood results showed that, you were good. But if then you've developed diseases, because sometimes you get medically boarded because of health issues. They might be work-related or not. If they are work-related, then you'll have to be compensated. So there are other processes that are involved there. So the OMP does that. But the OMPs in other companies, for instance, I know I used to locum for one gentleman a couple of years back. He was part of the doctors. He's an OMP. He was part of the doctors that were employed by Mercedes-Benz South Africa in East London, or Daimler Chrysler, whatever. I don't know what they call themselves these days. But in East London, at the manufacturing plant there, they've got a staff clinic with an emergency or resuscitation area. So you work certain hours, and this was like almost 10 years back. This guy was paying me 1,000 rands per hour. I don't know how much they were getting paid, by the way, but that it means they were getting a lot. He was paying me 1,000 rands per hour. So they were the ones who were actually seeing the patients there, who came for the minor ailments, and when there's an emergency, like maybe someone gets injured at the plant, then they get sent there to be stabilized and then sent to hospital. Of course, they've got medical aid, so they would get sent to private hospitals. So you can get employed in that, or as an independent contractor. You can also you can establish a company. There are a couple now that exist which have established themselves in that space, in the employee wellness space. So you are responsible for all the employee wellness programs in the company that contracts you. So that would include the clinic, but there would be other programs you'd have to do with counseling, trauma counseling, or stress, mental health issues. Have employee wellness days, doing activities, all of those things. So you get contracted, you get a budget or a certain amount of money per month, and that's what you do for the company. But you're not employed, so that means you as a company, you've got your own employees or people that you pay to provide those services to the company. The company that contracts you doesn't care how you do it, as long as you deliver and you use qualified people. Then I'm gonna say this, majority of people who work in the corporate space are medical advisors. So they work mostly with healthcare funders, which is your medical insurances, medical aids, and people who basically, the companies that are in that space. So your Momentums, your Discoveries, Sanlams, because others, they don't necessarily fund healthcare, but when you've suffered a certain injury or illness that is debilitating, your disability covers kick in. So these are the guys who go through the file and see, assess, make an assessment if you qualify, and if you qualify for the full amount, or there should be deductions and all of that. So your medical advisors work in that space. These are the people that your doctor, not your doctor, you as the GP will call to get pre-authorization for certain treatments and procedures. When you want to fight with medical aids and they haven't paid for something, sometimes you end up talking to the medical advisors. They are also used by the pharmaceutical companies, but pharmaceutical companies sometimes call them medical science liaisons. I guess it depends what you are actually doing there, your exact role. But essentially, medical advising is about using your clinical knowledge to give input on whatever policy, protocols, guidelines, formularies, whatever. They don't only use doctors, of course, they use other health professionals, but I'm talking about doctors now specifically, that you are essentially using your clinical knowledge to give input on whatever you'd be working on. It depends on the nature of the job you're employed for. Then we do also have technical advisors, but they are not called technical advisors. They might still be called medical advisors, but they are more specialized. Technical advisor is a term used in the government space, but you do get such people even in the corporate space. People who are experts in health policy, in health economy, basically public health medicine. All the components, they are experts in that. People who are experts in the business of healthcare, because healthcare has an aspect that is clinical, where you must render services to the patients, but there's also the aspect that is a business, where you need to make business decisions, like your medical aids shrinking your benefits, but the premiums keep going up. That's a business, those are business discussions and decisions. Your medical aid telling you you need to use pre-approved service providers in their network because they've got agreements with them. Those are behind the scenes business processes that happen to minimize, the medical costs that they incur on your behalf. Others, obviously, then like your Discovery, there's Discovery Health, which is the medical aid. Then there's Discovery, which is the company, the administrators, which also administrate a lot of other medical aids, and also have businesses, Discovery Bank, Discovery, don't know, is there something they don't have? But they are everywhere. So there's that it started as a medical aid, but moved, so those are business. You need doctors sometimes who have business acumen. So it's not always doctors that are there making those decisions, but as a doctor, if you've got business experience and business qualifications, a proven track record, it puts you in a good position to be in that space, and that's where they really make money. Doctors make money, specialists make money, but where the money is really where these guys sit in the boardroom. Then you've got what we call a health assessor. A health assessor is basically like when you've had an accident, car accident, your car is damaged, then you get asked to take it to an assessor. They check the damages, then they estimate what needs to be repaired, and then they get the quotations and all of that. So a health assessor, essentially something like that. If you get injured, I know I mentioned this under OMP, but it's not only OMPs that do this, even GPs and other specialists, they do this as well. If you get injured, or you get a disease or an illness that's giving you a disability, temporary or permanent, there are people who are trained to assess either by the health insurances, or which must pay out, or the employers, the companies. Also remember that Department of Labor has what we call COIDA, which is compensation of injury and disease adjudication, something like that. But it's essentially a division within Department of Labor that deals with injuries on duty, or people who develop occupational diseases. Yeah. So here they usually hire the OMPs, people with the diploma, doctors with a diploma in occupational health, or specialist occupational health physicians. There is actually a specialist, like a fellowship in occupational health, in case you didn't know. So they get those people to do the assessment. There are guidelines that are used specific for injuries, AMA guides. But for diseases, then they've got other criteria that they use to decide how badly it is. Are you fit to go back to duty? When are you fit? Do we need to make any accommodations for you? So they make all those recommendations. Or do they need to medically board you? So yeah, so where I work, part of what we do as a medical team is actually close to that, because we assess people for injuries and degree of severity, medical care that you will need, all of those things. So, but in our case, we outsource this, so it's done by independent contractors, right? But that will be changing soon. So we will insource that service now. It will be done by our people. I mentioned traveling earlier, or field work. There are people called travel doctors. It's usually, I wonder why, but it's usually old GPs that do this kind of work. So they get sent by the insurance. When you take out your life cover, disability cover, and all of that, and then they send a nurse to come and do the bloods and your vitals and all of that. Sometimes they send a doctor. We actually also now are seeing quite a number of medical aids which are using either companies they contract, or their own people that they hire to manage patients who are being treated at home. So for minor things, like if you need IV antibiotics, or there's, you need to be monitored, but you don't necessarily need to be in hospital, because hospital bed on its own is an expense. So you can be monitored at home. All they will do is they will provide the resources that they monitor your vital signs and whatever else needs to be monitored, and then they send a nurse or a doctor to come and review you. Okay, so that is happening as well, besides the health insurance thing of them coming and doing examination and blah blah blah. But we are seeing now a number of people being treated from home. It's not your simplistic home visit by a GP leaving his or her practice, carrying the basic things and going home. No, they've got companies that actually have machines that monitor your vital signs, which is linked to a center where a doctor sits behind a computer monitoring. So if the alarms go off, then the doctor quickly makes a call to find out if everything is okay. Then obviously if there is a need, if it's an emergency, then they would decide what to do. This brings me also to telemedicine, because there are companies that hire doctors to sit in their call centers. The biggest one is International SOS, which is always looking for doctors, emergency trained doctors, to sit at their centers and advise when they receive calls on emergencies, specifically for patriots, people who might be traveling internationally and encounter emergencies. Sometimes they are in countries where they need to be evacuated, but there's a term now I'm forgetting, again English is failing me, but they need to be lifted out of the country. Maybe the level of care they need is not available there, so they need to be lifted out and taken to the nearest proper hospital or city, whatever the case is. So we've got that. And also some of these medical aids have got platforms where you can actually book appointments with clients, and then have either telephone call or a video call. Discovery even has something they use where a patient can take some of their vital signs with it, and it will feed that information to your device with whatever you are using when you do the consultation. So there's innovation in that space, and it's a growing area. Companies are taking advantage of it. So yeah, it's a business. For people who don't really want to be employed for long, it's something worth exploring. There are a lot of opportunities in corporate medicine actually, but I think because people are not exposed, you need to network, unfortunately, to get to know about some of these things. Then you've got sports physicians who work for these. I'm not talking about the doctor that gets asked by Abahlali football club down there in Nanda, to pitch up on that on the day of the match, or when MJ and Damtura organize a boxing match there in Malamulel, and then we ask a friend of ours to be. No, I'm not talking about that. I'm talking about a job, like a proper job. You get hired, you get a salary, benefits, and all of those things. You get a decent salary. Some have a post-grad qualification in sports medicine, some don't, but majority do. And if they don't, you are encouraged to do it, because sports medicine is a specialized field, and it's becoming more and more specialized now. So it's difficult to practice there with just general GP knowledge, you're going to miss important injuries. You know how these football, like the professional athletes and the sports people, the football people and the rugby guys, you know, they will tell you you've got a torn ligament or tendon, something. It will take you 6 months or 8 months to recover. That needs, you know, you can't thumbsuck those things. So these the professional clubs, sports clubs, they hire sports physicians. So it's also a thing to consider if you are into sports and medicine. And actually, you can even have your own practice, by the way. There are a couple of sports physicians with their own practices. Dr. Wenya, who's the chief medical officer at SAFA, who looks after Bafana Bafana. And I think he also oversees the recruitment of the part-time doctors who oversee the other professional football clubs, Banyana and under what and under what. He started, you know, very small, got that role, and he made the best of it, and he equipped himself with the knowledge, and now he's got a practice. I think it's in Roteport somewhere. I hope I'm not mistaken, but yeah, he's got a private practice here in Gauteng, doing his job as well. So and he's getting many other gigs within sports medicine. Then we've got people who do training. You can be employed to train people on certain things. Doesn't really usually require specific qualifications, but it helps if you develop yourself in that area, because training people is a skill, facilitating is a skill, like facilitating a workshop or whatever. It's a skill. So you can do that as an employee, or you can have your own company training people on specific things. And there are a lot of short courses these days. You know, you've got your emergency short courses, and you can actually be a trainer. You can work and be accredited as a trainer in those certificates. The ATLS, PALS, ACLS. We can work to get and be certified as a trainer. We've got people training people on the how to use the AMA guides, the ones we use for evaluation of physical impairment. We've got people training. Sometimes we get hired by the Department of Health actually to do these workshops on infection control and HIV/AIDS, TB management, all of this, MMC, male medical circumcision. So you can do that as an employee, or you can have your company have a niche or area of specialty and work on that. And then last but not least, we've got health executives, the guys who make the money. These are the ones who decide on the strategy of the company, in which direction is the company going and how are we going to get there. What is our 2030 vision? And how do we get there from 2025 to 2030? What do we need to have achieved by next financial year and that year? And they also innovate these products that keep coming up. These are your executives in these companies. And they oversee teams of medical advisors of this and that and that. They look at the latest trends, the data, what's new, what's changing. So how do we need to adjust, So health executives are everywhere where there's medical services. So you can essentially work anywhere as a health executive. The difficulty with being a health executive is, and which is a reality for I think most executives, the failure and success of your team is on your shoulders. Unfortunately, it's not like government where you can just shrug your shoulders and say, there you take accountability and responsibility and ownership. So if things don't go right, you might be gone. And sometimes you do everything you're supposed to do right, but unfortunately your team pulls in the other direction. So that's why leadership skills are very important at that level. Secondly, the other problem is with once you've reached a certain level in terms of earnings, your salary scale, it becomes difficult to beat that because companies are always looking to save. So unless you are offering something extraordinary that they can't get from someone who's asking for less than what you'd be asking for, you're going to struggle to get a job. That's why it's important that even as a health executive, be good at what you do and be extraordinary so that companies are fighting for you. You see now, I can tell you with certainty, someone who's earning 2 million and above right now, total cost to company as a health executive, to be hired by another company at a higher rate, at a higher scale, like significantly higher, not 10% or 15%, say like 2.5, like close to a COO, CFO, CEO type of salary to get to those levels. So yeah, you have to be good at what you do. That's the downside of going up the corporate ladder, that you reach a ceiling wherein if you want to climb further, you need to bring more to the table. The bare minimum or the average is not enough. You need to be extraordinary. Right, guys, it's been a long one. We'll continue this session at a later stage, and then I'll give you some more information on corporate medicine. But remember, I said that I will share Dr. Mella's, the link to her videos. She summarizes nicely, and I think she edits her videos at least, so you won't fall asleep. And she keeps them short and nice, but you learn a lot from them. Just that I didn't want to include a lot of the information she included about research, people, and public health and what, because public health, yes, they can work in corporate, but a majority of them, you'll find them working as advisors for your NGOs, your AU, or NICD, National Infectious Communicate or something, but the one that's affiliated with NHLS, or government, or working for districts, like your Cape Town Metro District. You don't often find them because there's also few of them as well, so you don't find them everywhere. But yeah, anyways, do have a good day, and I think we will meet each other after the new year. So happy new year in advance.